Let's use these illustrations and pictures to define what a normal posture is and what a dysfunctional posture is. I'm going to define posture as how the thoracic block, or triangle as it looks, how the thoracic block sits over the pelvic block, how your rib cage is sitting over your pelvis. So with this woman, notice she has a vertically aligned neutral posture. This is what we're going for. This is gravity, how gravity would act through her body. It would go through her rib cage, over her pelvis, and land in her midfoot as she contacts the floor. Neutral, neutral, good. Oftentimes, mostly in the clinic, especially with postpartum moms, I see a tipped back thoracic block, as exampled in the next two women. This is because we need to make room for the baby. So just naturally, our thoracic spine, rib cage tip back, and we have a beautiful baby growing in front. So with this woman, her thoracic block is tipped backward, or her sternum is tilted up to make room for baby. Gravity would not act efficiently through this spine, through this posture. Likely she would have an increase in lumbar curvature or lumbar extension. So that's one way. Another way I commonly see in the clinic, how females present postpartum. This woman's thoracic block is tipped back, her sternum's tilted up, and her whole rib cage is shifted back also. So, again, gravity would not act as efficiently as this woman. Her thoracic and lumbar spine would likely extend, putting extra stress in the back and creating more work for the front. Just not an efficiently stacked posture. Let's take this next into some real life examples. As a clinician, I've had patients come to me telling me that they've been advised to change their posture in all sorts of crazy ways. Most common are to bring your shoulders back and to tuck that tailbone. Well, I'm here to tell you today, those are not valid cues. Let's see why. As we learned from the previous video, it's a common occurrence for postpartum women to have a thoracic block, the little triangle on top, to be tipped back. Our sternum is tilted upward to make room for the growing baby. And at some point, there's just nothing you can do about that during pregnancy. It's going to happen because that baby's got to grow. At the end of pregnancy, our diaphragm isn't working well. We're just inefficient. We have low back pain, pelvic imbalances. Well, that has a lot to do with our baby is just getting bigger. So we're left in postpartum with a tipped up sternum. And remember that shift, we may or may not be shifted back also. So what I'm going to encourage you to do, rather than tuck your tailbone, watch how my low back curve changes. When I take my hand on my sternum, you can do this too, and just guide it down. See how the stripes on my shirt change from lifting up to settling down. See how the curve of my low back goes from extreme thoraco-lumbar curve to neutral. Notice how my rib cage becomes flared up, end of pregnancy, postpartum, to settle down. Stacked thoracic block over stacked pelvic block. What I'm trying to tell you is, by changing the angle in which your rib cage is projecting, using your hand on your sternum, you can change the curvature of your low back. And then you won't have to do this funky tailbone tuck anymore. And I hope I've illustrated that it's never really efficient to squeeze your scapulae together because we're likely already very much tilted up also. Okay, so you're like, Dr. Becky, now that I have this efficient posture when I'm standing, how do I apply that to real life? Okay, when you come to this posture, stack rib cage over pelvis, notice where the weight falls into your feet. It should be equally balanced between forefoot and heel. And in this posture, I want you to hopefully notice that your abdominals are automatically engaged. There's no like, oh, I should brace my abs. I should use that TA contraction, transverse abdominis contraction, to stand and just efficiently walk. I should have to volitionally think of this. No. When you come to that neutral stack posture, you're already set up for success. If you start here, when you start walking, when you reach for something on the countertop, those abdominals are already going to be bracing and give you that inherent stability right off the bat. I hope you can apply this lesson to any exercise training you're doing. Stand in a neutral posture, and then you'll be training your muscles even in bicep curls. Stand in that neutral posture, and then when you're doing your curls, you're training yourself for lifting groceries efficiently. When you're doing your squats, align neutrally first and go from there. You already have a neutral alignment set up for success. When you're standing washing dishes, align yourself neutrally and you have to walk away. You're already there. You're already fired up and ready to go. I hope you can apply this to both any exercise program and everyday life.